I understand the hospital has received a $4 million grant from the Robert Wood Johnson Foundation to launch a new community care initiative. Please tell us about this.
Sure. We're very excited about the Robert Wood Johnson Community Care Initiative. As you said, this is a $4 million grant from the Robert Wood Johnson Foundation, and we're very, very appreciative to the foundation for supporting our endeavor. What this grant is really designed to do is to link the communities that the hospital serves together in order to keep patients from rebounding to the hospital after they're here. So it's a combination of direct services to patients and information technology. From the information technology standpoint, it's to tie together the provider network of physicians in the hospital so that we know exactly what has happened to patients, what is happening to patients, what's happened to them in the past, in order to make better decisions about their care. On the direct care side, it's really to support a concept called transitional care, which we have to give credit to Mary Naylor out of the University of Pennsylvania. She's a Dr. Mary Naylor, a PhD nurse from UPenn, who pioneered this model, which really involves supportive systems for the patient after they leave the hospital. Some patients get home care services. That's a formal benefit under the Medicare program or a managed care program for someone who qualifies to get services at their home. But transitional care is similar but different in the sense that transitional care is designed to partner with the patient and make sure that they understand and have access to all the elements of care delivery and the care delivery system so that they can continue to stay out of the hospital after a hospitalization. So a patient would be in the hospital, they'd be seen by a transitional care nurse while they're still in the hospital so the person gets an understanding of their case. After discharge, that same person would continue to partner with that patient, both visiting them at home as well as calling them on the telephone in order to understand what are their needs and make sure that they are able to get services like physician appointments, review their medications with them at home, make sure they're doing their physical therapy, make sure if they're supposed to be weighing themselves every day that they're doing that, look at the food that's in their house, make sure it's the right diet for them, and generally answer questions and avoid problems that might lead a patient to come back to the hospital. And so we're very excited about the grant. We're hard at work in developing this system, and we're going to see great outcomes from it.
What advice would you give to other healthcare professionals across the nation?
So I think healthcare at this time is a very challenging endeavor, but I think that's exciting. And I think the first advice I would give to everybody, I would quote Arnold P. Gold from the Arnold Gold Foundation, who said that to be in healthcare, but he was talking about physicians specifically, he said it's a real privilege, it's an honor and a privilege because you get to experience the full range of human emotion and get a chance to help people. That has not changed at all because we're going through healthcare reform, because we're undergoing change. So I would say to any healthcare professional, remember why you're doing what you're doing. You're still there to help people. And I think all of this change, for those who prepare for it, I think is exciting. I think it's a great opportunity for those who are changed. There's going to be all sorts of new careers. There's going to be all sorts of new opportunities. There's going to be all sorts of aligned incentives that we should actually have the opportunity to deliver better care. So to me, I look at it as a very exciting time, and I say don't despair, embrace the change, and you have a great career ahead of you.